Hello, everyone, and welcome to the fourth session Up to the Challenge. Every session will host guests that highlight the different SDG themes covered at the Financial Times SDG Challenge. I see that people are joining already, and it's really great to have you all with us here today. Feel free to drop a line in the comments where you're connecting from. So today is about good health and well-being. So ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. Currently, the world is facing a global health crisis unlike any other. COVID-19 is spreading human suffering, destabilizing the global economy, and upending the lives of billions of people around the globe. Before the pandemic, major progress was made in improving the health of millions of people. Significant strides were made in increasing life expectancy and reducing some of the common killers associated with child and maternal mortality. But more efforts are needed to fully eradicate a wide range of diseases and address many different persistent and emerging health issues. If you're innovating in the health tech industry, working on solving doctors' challenges, insurance, access to healthcare, and mental wellness or prevention methods, you can apply to our Financial Times SDG Challenge through this link. And if you have any questions about the challenge, feel free to drop them in the comments. I'm connecting today from the Financial Times, and my name is Heya. I'm the Business Development Coordinator at FT Talent. Today, I'm really happy to welcome back Hisham Al-Fishawi, founder and CEO of AtHomeDoc, on stage. So we're just gonna be bringing in Hisham on stage right now. Hi, Hisham.
Hello, Haya.
Hi,
Thanks
nice
for
to
having
see
me.
you. Happy to have
Likewise.
you. Thank you.
Thank you very much.
Thank you. So we're gonna have a few questions for you.
Please go
So
ahead.
our first question is, please tell us a little bit more about yourself and AtHomeDoc.
I'm Hisham El-Fishawi. I'm one of the founders of AtHomeDoc. I'm 43 years old, an engineer by profession, and I have a twin brother who is a doctor. So I've been very close to the healthcare most of my life, seeing him suffering in the medical school until he's now a doctor in Australia. So I've been very close to the industry. Although my professional life, I've worked around customers in most of my life. I was in the supply chain solutions. I was a consultant in the supply chain, providing solutions to customers. And until 2015, when we both decided that we should start AtHomeDoc. And since then, we are here. I jumped ship. That was in 2017. AtHomeDoc is basically a primary healthcare provider that offers affordable house calls as well as telemedicine services to patients round the clock. And we started the company actually registered in Australia. That was back in 2015. And the purpose was to learn more about the industry, as home doctor services are part of the Australian system. And that's where we learned all the clinical guidelines from there. And we thought that this has to, we have a room here in the Middle East where we need this service, and it contributes a lot to different customer segments here. And we registered the company in Qatar. That's where I live for 15 years now. And we started the company back since early to 2017. Then it's been a year for us now in Egypt as well. We've expanded to Egypt in certain areas, and here we are today.
That's great. Thank you so much. So
Welcome.
the next question was, how did it all start? But you already gave a lot of information. If you want to add more detail to that.
It actually started as a house call service, and then we've always had this in mind that telemedicine has a lot of potential and a lot to offer to people around the globe. It's a borderless service, and since the pandemic, we've shifted our model to be more of a hybrid model between house calls and telemedicine. But initially, it was a home doctor service that evolved into both telemedicine and house calls. The beauty of the service is that we tailored it, that it integrates with laboratories as well as investigation centers and pharmacies. So we provide a comprehensive service. So as soon as the doctor examines a patient, a prescription gets delivered to your doorstep. And if the doctor needs more evidences before they reach into a diagnosis of a condition, they need evidences, so they might request labs. So now as well, the laboratories can come to your home and collect the specimen from your home without the need to leave your premises at all. So this is how it evolved, and that's what we're doing today.
Mm-hmm. And who is your startup catering to, and how exactly are you supporting the SDG goal, good health and well-being?
A good question. So it's two questions in one. The first part, the customer segments, we're catering to mainly three customer segments. We cater for direct consumers, those who can afford to pay the service out of pocket. And then we have the B2B2C, such as those people covered by medical insurance and deal with the companies that we have direct billing system with, such as in Qatar, Al Qut medical insurance. We have about 160,000 lives covered under direct billing service. And we have also businesses. So we have schools, nurseries, hotels where we provide medical staff on site to examine their employees and students on regular basis. That's generally speaking about the customer segments we're catering for. Um, from the SDG perspective, since we've been practicing the telemedicine, actually, I see that the telemedicine is actually contributing to a lot of in three different tiers of the SDG goals. So if you're talking about whether it is the environment, whether it is the society or the economy, it touches each and every point of them. For example, directly contributes to the health and well-being by offering the basic healthcare services seamlessly through the phone or even through an affordable home visit. So this contributes directly to SDG number 3, the health and well-being. Again, offering the service as a primary care, it impacts drastically the cost of healthcare. And that's what we're lacking in the Middle East. Primary care isn't that well popular here for many reasons. However, when we focus on the primary care, it really reduces the overall healthcare costs drastically. So you have those people who have primary care physicians in the US save about 33% on their overall healthcare costs and have 19% lower odds of dying. So it impacts indirectly the equity by making the cost more efficient. So hence, payers or insurance can afford to reach out to more people. In a different angle from the climate action, if I may say that in Qatar, for example, there has been many articles published about unnecessary trips to emergency departments, where on different occasions, the ambulatory service published that 90% of the calls are non-emergency. People walking into the hospital for emergency cases, 80% of them are the cases that does not require clinical sittings. So it impacts as well the reduction by reaching out through the phone to those people in need. There's a quite significant reduction in the carbon emission by reducing the unnecessary trips to hospitals and clinics. On a different level, it can be the innovation. The innovation which contributes to the economy. Now look at AtHomeDoc. It's a company homegrown, and now we have about 10 investors in our cap table, and we're seeing more patients and growing exponentially day after day. So this innovation actually contributes to the SDG. So I'm saying that it contributes to the whole SDG, like at least 4 of them.
Mm-hmm. That's great. Thank you.
Welcome.
So what are the biggest challenges you've seen when working in the healthcare sector, especially in emerging markets?
Um, That's a good question. The challenges basically starts with in emerging markets with the regulations initially, especially if you're innovating and doing something for the first time that no one else has done it before. So there is usually this gray area where there is no regulations that sets it clear what is the right way of doing things. So I think regulations was one of the biggest challenges that we have to find ways around it in order to work. And healthcare is a regulated industry, so it's not just a last mile delivery or an Uber kind of model where your relationship with the driver ends by dropping you off. Healthcare is a sophisticated industry that has lots of complexities and liabilities, and we had to make sure that we comply as much as we can with the local and international guidelines and regulations. The second would be for me the skills and finding the right talents that you can attract to something new when you're starting your business, which is quite challenging to find people willing to take the risk and make this, huge leap into the unknown. That was a second challenge, and I believe the third one would definitely be funds. So finding the right investors in the Middle East is quite challenging. I'm not saying it does not exist, but you feel that finding the right investors is a bit of it requires skills actually, and it requires a lot of effort to make sure that you are able to sustain the business on a longer term. So these are basically the three challenges that I think are most common when you start businesses in the Middle East, especially in healthcare.
Yeah.
Yeah.
So throughout the past 3 years, what is the impact that you're most proud to have achieved?
That's a big word, impact. I would be proud of two things mainly. Actually, we've seen, as we speak, 40,000 patients in the last 4 to 5 years. And that's quite a significant number of people that we've examined. And we made their life easier by accessing care in a seamless way and catering for them on site and as well as through the telemedicine. That's something that I'm proud of. We've also tested the telemedicine during the Beirut explosions, and we extended free consultations to the people in the crisis. During the crisis, a lot of them suffered. They needed a lot of mental health support during this period, and we were able to offer a lot of people help remotely and seamlessly. We've also run different campaigns in Yemen and Libya for offering, extending the service to the people in areas of need. And that's when you feel that you've accomplished something. From a business perspective, it differs from where you operate, and each market has its own contributions or challenges that needs to be addressed. For example, in Qatar, Qatar is one of the highly ranked Arab world countries in healthcare. I think it's ranked number one. But this is when we talk about the public sector. But when you talk about the private sector, like any other Arab country, most of the private sector is focused towards revenue generation, investing in hospitals, cosmetic surgeries, dentistry, anything that generates more income. So investments are more directly in the private sector towards the highly generating revenues, specialties of medicine. So none of these are focused as we are on the primary care. So we're very proud that we've established something that focuses on primary care, and the value that it drives is significant. But when you go to Egypt, for example, there is a lot of flexibility over there in terms of regulations. So we were able actually to offer different services during the COVID, where we got a lockdown in Qatar. We were not able to see patients. In Egypt, we were seeing a lot of patients at home due to the lack of capacity of hospitals. So in the case in Qatar, the hospitals are enough, there is enough beds, there is enough finance in the system to support all those people. But in Egypt, it was a bit different. So in Egypt, we were able to reach out to people at the most needed time to offer the care to them at home. Offering different services as well, such as vaccines, such as rapid testing. So all of these have been tested, and we are so proud of what we did and what we learned over the past years. Alhamdulillah.
And since you work in the field of healthcare, how urgent is it that people innovate in the field, and what is the economic impact of it?
It is very urgent. I mean, healthcare is essential for human capital. It's what maintains people, and this is what maintains society and innovation. So you need to take care of people. And if you count the needs, there is a lot of room to innovate and a lot of problems to solve. For example, you know that 23% of deaths causes are related to environmental issues. If you came to know that 90% of the world population is breathing unclear air and not complying with the WHO recommendations. If you know that 50% of the world population have no access to primary and essential health care. If you know that, for example, the quality of diagnosis can go down to 30% in some of the remote areas, and that people are not getting the help they need at the right time, which makes the cost of treatment increase by tens of times by the time they actually reach to the primary care units. If you know that 235 million people suffer from asthma, you have about 100 million people every year being pushed towards poverty because of their spending on healthcare. If you know that about 6 million kids die every year before they reach the age of 5 years because of the absence of vaccines or the primary care. So there's a lot of things to contribute to, and a lot of areas of improvement that really innovation can help a lot in the coming few years.
In a past conference, you were speaking of the ratio of patients to doctors and how low it is in some emerging markets.
Yeah, that's a fact, and sadly, the percentage per capita, you will find it correlated to developing countries. So sadly, developing countries have the lowest density of doctors per capita. So in the WHO has set a ratio of 1 to 1,000. So one doctor for each 1,000 people at least needs to be there to have a balanced service offered to people as a minimum requirement. That's not the optimum. However, in some countries, you can find, like in Africa, some countries can go down to 0.7 doctor per 10,000 patients. So it is there is inequality in the distribution of the resources. Talking also about the vaccines, it does not reach actually the areas of need at the right time, and it's not fairly distributed, the resources. Comparing developing countries with the developed ones, you will find a significant increase in the number. Like in Russia, for example, the capacity is 44 doctors for 10,000 patients. In the US, it's 30 plus, I guess. So in Egypt, for instance, it's 7.5 doctors for each 10,000 patients. So it differs to where you are, and if the country is doing well, you will find the country doing well in healthcare. So it's correlated, developing to developed. It's correlated to how are we maintaining the health and well-being of people in those societies.
And what can we expect to see from AtHomeDoc in the future?
Yeah, hopefully a lot. And we are actually more focused now to expand in the telemedicine. Our growth has been exponential lately. This year, due to the telemedicine, we anticipate to achieve 145% increase of bookings compared to last year numbers of bookings because of the telemedicine. We made it pretty much affordable for people. In the previous years, also what to expect from AtHomeDoc is to focus more on our front-end technology. In the past few years, we were pretty much focused on developing our cranium. It was a back-end system that connects doctors, patient records, insurance providers and direct billing, connecting laboratories, pharmacies. All of that has been accomplished, alhamdulillah. And this year onwards, we succeeded to close another fund round successfully with investors. And we're pretty much focused to deliver a lot in the front end side and reach out to more patients in different markets. And there is one more thing.
Yeah, go ahead.
So we've been always focused on treatments. So we're reactive. So we usually waited for people until they feel sick and they call us, and then we go provide care. The coming future of AtHomeDoc is that we're going to be tapping more into awareness and prevention before treatment. So and this will also something else that we're going to focus on, which is the integration with more insurance companies and how can we contribute to, if possible, to subsidize insurance premiums and making it more affordable for people to buy them in order to make it accessible and easier for people to acquire care at the right time.
That's great. That's definitely needed. Thank you.
Thank you.
With the upcoming FT SDG challenge, we're scouting for people who can propose innovative solutions to good health and well-being. What, in your opinion, are the areas that are urgent to address?
The whole list of areas I've mentioned, the world is suffering a lot, and the pandemic has examined us actually. And you can see that a lot in the biotechnology now and the vaccines, and a lot of room here that people can innovate to make a change. And those 2 years have proven that technology is solving a lot of issues. And if I may say that nature was sending us a message, right? And the crisis created a great opportunity to change some of our practices and look at how we will live and work better in a better partnership with nature. So I think a lot of room is there to innovate in the virtual care and in the IoT and the remote care, and as well as I think the biotechnology is something that we should focus on, and the infectious disease actually is something that we need to focus on in the coming few years before 2030. I mean, that's where the objective of the SDGs by 2030. So, I mean, we have about 9 years now to innovate.
Mm-hmm. Yeah. So being a successful entrepreneur, what advice would you give to aspiring entrepreneurs?
What advice? That's a tricky question because I can't claim success yet. So, I mean, success is, it depends. I mean, the main definition of a successful person is the perseverance, I would say, because it is not easy to start a business. It is not easy to keep it going and keep it growing. I think the key here would be the perseverance. So, and the tricky part is that you will never have this perseverance if you start your business for the wrong reasons. So you need to have a calling first, and you need to be confident of what you're doing before you jump in there and you say, I want to be an entrepreneur. And thanks for those publications and stuff, you know, posting those handsome pictures of young people raising funds and starting their own fortune. I mean, at early ages. Yeah, it's tempting to a lot of people, but this would be a very wrong reason to start your own business, because you wouldn't last for 1 year under the normal circumstances of a startup, because startup is not easy. So you got to be well prepared. you gotta have a step back and ask yourself this question: why am I doing this? And it has to have a bigger calling for you to be able to sustain this kind of effort for the rest of your life.
Mhm. And if you could share a message to the audience watching on this topic, what would that be?
Well, the main message I want to share is, especially if this audience is in the Middle East, in Africa, and the MENA region, primary care and prevention has always been something that we're not focused at. And I think that what makes the difference between longevity between the average age in the Middle East or the Arab world compared to the developed world, where you find that the age people live longer abroad, for one reason is they start caring early about themselves. So you don't have to wait until you feel that something is wrong happening with you. I mean, having a primary care provider is something really important. I think you're based in the UK, like in the NHS is doing fantastic job there. Like no citizen in the UK has, you must have your own primary care doctor, and that's how you maintain your health, and you make sure that you contribute to your economy, your society, your family, and that's how you maintain your health, not even the physical health, but also your mental health, and how to perform. And this is how we contribute to the mankind and human, I mean, the population overall. And one thing that I've concluded over the years is, if you're making living and you're getting enough cash for the exact same amount of effort you're giving to this job, it means that's not enough, unfortunately. So it only makes a difference. You can only make a difference if there is a deficit. This deficit means that you exert more effort more than what you're getting. And that's when you will actually see the progress and see life improving around us. And that's it.
Mhm.
I
We
hope
got
it
a
makes
question.
sense.
Yeah, it did. We got a question from the audience. Someone is asking, how do we improve doctors' lives in the Middle East slash emerging markets?
Doctors' lives. I mean, that's a very broad question, and it differs between one country to another. So there is no one answer to this question. So if we're saying that if we're talking about emerging markets like in Africa and Egypt, I mean, providers have to support doctors, um, and the regulations has to consider that the essential role the doctors have in sustaining societies and offering this to helping in leveraging the well-being and the quality of life of the people in each and emerging country. I know that there are a lot of challenges in countries like Egypt, where doctors have to suffer a lot, whether it is in the training hospitals or even with the public hospitals. But there are a lot of efforts happening now in putting things back on the right track. Like in Egypt now, the compulsory insurance, they call it the universal insurance, is setting things back on the right track. And you cannot fix just the doctor's life. You have to fix the whole system. And the doctor is an essential part of this system. So, for example, the funds allocated for the prevention, the payments, all of these are things related to enhancing the doctor's quality of life. Doctors are now selecting specialties that are less risky for them, and that is making them more money, like dermatology. And they know that if I'm a dermatologist, I'm going to be making 10 times more than if I'm a family practitioner. So, and which is not adding a lot of value to the community. So a lot of work needs to be done on a regulation level, not just on individual level. In the private sector, I would call all the providers. It's just a calling. Healthcare is an ethical job. Unlike different industries, ethics plays a big role here. So we should not only be commercially focused And we are a type of company that I go to work every day trying to make healthcare more affordable and finding solutions to make it more affordable for people and accessible. And in the same way, offering better chances for our doctors to improve. So we provide training for our doctors, regular trainings. We provide them with needed PPEs when they examine patients, and we do all the support to them, even with, as I said, with the training matters and keeping them updated with the latest in their fields. So there is a lot. Doctors like to be updated, by the way. So in order to cater for the doctors, you need to take care of them holistically, not only from one angle. It's a complicated task and requires a lot of effort from different stakeholders in the ecosystem.
Okay, great, thank you. And we got another question from the comments.
Yeah.
Do you have e-prescription in Qatar?
So yes, the public system has the e-prescription. In fact, since the pandemic, no one is using the paper prescriptions anymore, unless it's a private clinic. AtHomeDoc, basically, we have the e-prescription. So people receive their prescriptions on their apps. They even have it delivered to their doorsteps. So yes, we do have e-prescription, and pharmacies are accepting the e-prescriptions now.
We got another question. Did you have any governmental support or support from any institutions? And do you think it's important?
Sure. So we were lucky. I would say that being in Qatar, an Egyptian in Qatar, who's starting a business should be challenging more than, like it's not, I was not born and raised here. I came here when I was like 33 years old. I was quite fortunate having the good people around me who believed in me, like in the company as well. Like we have the Qatar Development Bank as one of our investors. The company is incorporated, although in Delaware, USA, for the sake of, regulations and to be able to raise more funds and those sort of things. So yes, we were able to have good people around us. So we have about 10 investors, institutional and angel investors. All of them have contributed a lot to supporting the idea from scratch and still supporting us. And we're very grateful to have them all.
We got another question. Could you please share some insights regarding the need for mental health assistance in the Middle East?
It's a tricky question. This is something that Atomdock is going to be tapping soon, offering psychotherapy at home. I mean, in the Middle East, there is a barrier here. People don't want to be seen at a mental health institution for receiving a basic psychotherapy session. It's a bit challenging for also the culture. It differs from one country to another. I know some cases where husbands refuse to send their wives for psychotherapy sessions, and I can't actually disclose because I don't have the right data to talk about in this field in the mental health. But something I know about, the most prescribed medications during the past 2 years are related to mental health. I'm talking about locally in the GCC, in the region. Due to the pandemic, a lot of people have faced social distress, and you know that a lot of people lost their jobs. People were panicking of the COVID. A lot of people lost their beloved ones. So there was a lot of need for the mental health lately, and I am sure that there is a big room here to offer the service to the people in need.
Thank you. Thank you so much for your time and insights, Hisham. Thank you so much.
You're welcome. You're welcome. My pleasure. Thank you for having me.
Thank you.
Thank you.
So this year, we, as Financial Times, have partnered with SeedStars to give our global competition a new twist. Our topics for this year are gender equality, good jobs and economic growth, good health and well-being, quality education, climate action, and reduce inequalities. Right now, the call for applications are open. We're looking for seed stage startups to apply to the 6 themes, and the application deadline is November 1st. So we got a question also asking, how do we get investment from seed stars and early age startups in the medical technology? So this is where you can apply to the FT SDG challenge. Startups can win up to 500,000 USD in investment and 3 months enrollment to Seed Star Growth Program, as well as a visibility package from the Financial Times. Thank you so much for listening, and we'll speak soon. Thank you.